This means inflammation of the inner layer of the heart. The heart's wall is made up of 3 layers, the epicardium being the outermost layer, then the myocardium, and then the endocardium, which is the layer that gets inflamed. It turns out that most cases of endocarditis are due to a microbial infection of the endocardium. Any area of the heart that's exposed to turbulent blood flow, like a narrowed cardiac valve or a septal defect, could be affected by endocarditis. Turbulence of blood flow causes damage to the endocardial lining. That damage exposes the underlying collagen and tissue factor, which causes platelets and fibrin to adhere, which forms this tiny thrombosis or blood clot. This is called non-bacterial thrombotic endocarditis, or NBTE, and it's non-bacterial because it happens even before the bacteria shows up. Then a microbe has to get into the bloodstream, and that might happen if a person has an obvious open wound or an abscess, a dental or surgical procedure, or injection with an infected needle or infected substance, usually while using illicit drugs. The valves are often affected because they're often the site of turbulent blood flow. Most often the valves on the left side are affected, the mitral valve and the aortic valve, sometimes due to predisposing conditions like mitral valve prolapse and bicuspid aortic valves. Risk factors for developing endocarditis include having prosthetic valves, having a congenital cardiac defect, having damage to the valves from rheumatic heart disease, and finally intravenous drug use can put valves at risk. Although most cases of tricuspid valve endocarditis are due to intravenous drug use, the majority of intravenous drug use patients with endocarditis have left-sided valvular endocarditis. Even without using intravenous drugs, there are other opportunities for microbes to get into the bloodstream, whether it's through brushing your teeth and having them slip into your gums, or having them slip in through your gut or lungs. Whatever the case, they regularly make their way into the body. It's not usually a problem though, because it's a small amount and can easily be killed by our immune system. But occasionally they float around in the blood for long enough to find an MBTE, which serves as a perfect location for them to attach to and set up an infection, called a vegetation. To attach to it, a lot of bacterial species